Hi, everyone. So, I have an amazing opportunity today. This is my very good friend, Katie. We went to grad school, to occupational therapy school together at UNC-Chapel Hill. We were class of 2008, so we've been friends for a long time. And she has a wide breadth of experience in different settings. So, from acute care to skilled nursing facility, inpatient. So, her point of view on those settings and the impact that incontinence can have on those patients was really eye opening for me. In addition to that, Katie is also the mom of two little ones, so she has that experience as well from a personal viewpoint. And in fact, she has her whole family out here visiting me this week. We just got back from Legoland, which was a lot of fun. And so you are with us in my backyard right now. But I wanted to ask Katie a couple of questions about, first we'll start with the impact that the weakening of the pelvic floor muscle can have on your life after having babies.
Mm-hmm. Well, yes, to my surprise, I always thought of stress incontinence, urinary incontinence as a problem that maybe you experience as a woman in your older years. So after having my children, it came as a big surprise to me when I tried getting back into working out again, when I went on the trampoline with them, that I'm already experiencing this problem, and mom all of a sudden has to get off the trampoline and run to the bathroom and change her clothes.
Yeah.
And I was very surprised to experience all of that because my OBGYN never mentioned it to me.
Right.
So I didn't realize how common it was because it's not very much talked about. So my closest friends I opened up to about, and, come to find out a lot of women experience this.
Yep.
After childbirth.
50% of women will experience it.
Yeah.
And really, over the course of a lifetime, that number is higher. But yeah, it's very common. So did you think of it as just kind of your new normal?
Yeah.
Yeah.
And that there was probably nothing I could do about it except maybe the Kegels. And after talking to you, I come to find out that that's not even the best method. That it's a totally different set of muscles that you should be using.
Right, because a lot of times we're not doing them correctly, the Kegels correctly, so we're not seeing the benefit of strengthening those muscles because we're not working on the right muscles, or we're up training the wrong muscles or down training the wrong muscles. So, and then what about in the skilled nursing facilities and acute care and the hospital?
Well, yes, come to find out, the long-term patients that I would work with, urinary incontinence was pretty much the norm for a lot of them. But working in acute inpatient rehab and even outpatient, I also came to find out that even my most independent patients who were elderly, maybe everything else medically and physically was fine with them, but also experience urinary incontinence as just a normal day, normal everyday thing.
And was that as a result of whatever reason, like if they had had surgery or something and they had weakening, or it was a pre-existing condition?
Largely a pre-existing condition.
Okay. And then the symptoms were exacerbated or made worse through the process of whatever they were there for?
If they were in, a traumatic car accident or, ended up with orthopedic surgery and, complications and whatnot, or even the most simple come in for a planned, rotator cuff surgery or something like that, just not being as active. Really did make a difference, and all of a sudden they were having more frequent issues.
And then what are the ramifications of or the consequences of having that in that setting? What can happen?
One of the most common things I see amongst all the settings are urinary tract infections. So with urinary incontinence, you're much more likely to have that happen. And unlike younger people and older people, believe it or not, a big symptom of a UTI is confusion, loss of balance. So often our our patients who come in from falls, a UTI is often the culprit
Interesting.
of what kind of started the whole domino effect. So they have a UTI, they don't even know it, they're confused,
Wow.
lose their balance, fall, break their hip, and it can go in a lot of different directions from there.
It just goes down. It can go downhill from there. So the whole point is not to be Debbie Downers, but to just kind of showcase how important it is that we continue talking about this issue of incontinence, whether we're new moms or if it's our parents who have been hospitalized, or if we ourselves find that we're in that situation. Just the importance of understanding what the impact is of incontinence. It's not just an isolated event or condition. It really does impact all of these other areas of our lives, no matter what age group we're in, or where we are in the continuum. And not only recognizing the importance of having the conversation, but to know that there's, no matter where you are in life, there's something that can be done about it. And it is important to get it taken care of. So thank you so much, Katie.
Yes,
I'm so happy you're
share.
here. And we will see you soon. Have a good rest of your day.